Hello, welcome to the ISTH Congress Daily News. I'm Dr. Maha Othman, a professor at Queen's University in Kingston, Ontario, Canada. And today I'm delighted to have Yunpeng Zhu to talk about his abstract, Novel Dual Action Fusion Proteins Combining Truncated Atom TS13 and an Nanobody Against VWF. Welcome, Yunpeng.
Yeah, welcome. Thank you. And thank you for the introduction. I'm Yunpeng. I'm from Synapse Research Institute.
I'm going to go ahead with the first question. I'm curious to begin with what motivated the development of this dual action fusion protein for treating TTP?
Ultra-large VWF multimer can be degraded due to ADAMT13 deficiency, which leads to microvascular thrombosis. This is the cause of TTP. And currently, the FDA have approved two treatments for TTP, recombinant ADAMT13 and cabazitaxel. So recombinant ADAMT13 is used to treat congenital TTP by increasing ADAMT13 activity. For cabazitaxel, it can inhibit GP1B alpha VWF interaction by binding to the VWF-A1 domain. So in our previous research, we developed a nanobody named VWF-A1. It has the same function as cabazitaxel. However, compared with cabazitaxel, the difference is that the nanobody only bind to the active form of the VWF, while the cabazitaxel bind to both active or inactive form of the VWF. That means the sin VWA1 can inhibit the thrombus formation by specifically recognizing active VWF. So based on this, we designed the fusion protein by combining nanobody with a truncated ADAMT13. So the fusion protein will have two different functions. First, inhibits the VWF platelet interaction. Second, ADAMT13 activity to degrade the VWF. So we believe that with the help of a nanobody, the fusion protein can be anchored to pathological VWF and cleave at microthrombosis location.
Well, this is very exciting. So, could you clarify maybe the specific goals of your study?
We aim to evaluate dual action fusion proteins that combine a nanobody against the VWF and truncated ADAMT13. So, in addition, considering that most TTP patients are caused by autoantibodies, we also bring a new idea to this study. We try to combine a nanobody with the previously reported autoantibody resistant ADAMT13 variants. And so the fusion protein combines the effectively inhibition and ADAMT13 activity, and also it can resistant to autoantibody. We hope this fusion protein can offer new alternative therapeutic treatment for TTP patients.
Wonderful. So, could you now tell us what were the main findings from this study?
Yeah. So previous study found that the triple alanine mutation reduced the cleaving activity to around 20% of Y-type ADAMT13, and even it gains resistance to autoantibody. Our results is same with that. But interestingly, when we add the sin VWA1, the nanobody, to form the fusion protein, the activity increased to 100% in flat VWF-73 assay. And in another VWF multimer cleavage assay, the fusion protein also shows that it's more effectively than the triple alanine mutation alone. So because we are not sure that the fusion protein still has the ability to resist the autoantibody, we test it with our ITDP patient's plasma, and we found that ITDP plasma inhibits the recombinant ADAMT13 to 40%, but the ADAMT13 mutant and its fusion protein keep their activity. So basically saying the mutate fusion protein keep its ability to resistant autoantibody and improve their activity.
That is great. So I'm sure our audience now would want to know, what does this mean in terms of the potential impact for this research on TTP patients?
Yeah, if successfully translate to the clinical, these fusion proteins can offer the more convenient and cheaper treatment. Compared with the traditional plasmid exchange, this approach do not require too long treatment and too much cost, and it will improve the patient's quality of life.
So this is great, but I'm curious now to ask you, what's next? What are your next steps in this line of investigation?
Yeah, firstly, we want to find out why the mutation fusion protein can increase their activity. Secondly, based on what we learn, we plan to make some improvements, such as different autoantibody resistant mutant, and the linker we use or replacing the nanobody part. And we also focusing on the preclinical study in mouse model. Although this is still a long way to go, but I think the cooperation will be crucial to speed up this whole process.
Right. Well, thank you so much for sharing your study and exciting data with us. I guess you've just finished your master's and you're on to the PhD. So I'm sure there's a lot to do during the next few years. I want to wish you all the best and thank you so much again.
Yeah, thank you.